Statistics suggest that up to 6 children out of every 1,000 will develop autism. However, the cause of this condition is still a mystery. We are joined today by Dr. William Murphy, an emergency room specialist, and his wife, Jerrine Murphy, a registered nurse and board-certified behavioral analyst. They both have worked to enhance the public's understanding of autism and improve the healthcare and educational resources available to families. Jerrine and Bill, thanks for coming.
Welcome. Thank you for having us.
Thank you for having us.
You know, I heard or read recently from one expert, this is probably one of the most urgent healthcare conditions of the 21st century. That's big, big time. And I wonder if you can explain to us what autism is. I think a lot of people don't understand it.
Sure. It's a neurological disorder, and it's manifested in different ways in different children. But there's some kind of basic core things that everyone has that has autism. One is communication. There are communication difficulties, and in some cases, almost a lack of communication. So there's either inappropriate or none. Social interaction is incredibly impaired, either in some cases the point where the child is in their own little world and can't come out, and other times where there's very, very inappropriate social interactions. There's oftentimes very kind of repeated stereotypic behavior, hand flapping, walking on toes, lining up 50 cars, doing the same thing again and again and again. And if that pattern or cycle is broken, huge tantrums and meltdowns that can last forever and ever. Those are, I mean, it's a very, very complicated thing, but that's sort of what it is. It's a communication and social disorder that can severely impact their lives.
And what age do you start to see this? And what age did your kids start to manifest some problems?
Retrospectively, I think from birth, when we look back and see that they never really interacted with us appropriately, especially the case of my son, really was averse to any type of physical contact. They used to run around hysterically laughing inappropriately, so inappropriate affect. And there was toe walking.
So when this happens, I imagine it gets conflicting sometimes. Is this just normal kids who are not behaving, normally, or I imagine that you went through some kind of conflict with yourself. Is this just a normal kid being misbehaving, or is there some neurological thing going on?
Well, I think being new parents, I was in every Mommy and Me group, so I had an opportunity to compare my children to other children, and also with my nursing background to look at all the developmental milestones. And I was alarmed that other kids seemed to be speaking earlier than my children. There was no attempts to mimic animal sounds. Language acquisition wasn't there. And we consulted with a lot of professionals, and they told us to, just be patient and, just urge people to really go by their gut feelings.
Right. And this was 10 or 12 years ago. I think there's heightened awareness now, but still, I mean, there's still, we see lots of other families with this, and they've, been told, he's just a boy, he's slow, right, he's whatever. Now, there are certain, they've actually come with national criteria now, and there's some national criteria that if these things don't happen by a certain age, if there's not happy smiling faces by 6 months, not babbling by 12 months, words by 16 months, sentences by almost 2, those are big red flags, and if those things aren't met, then you need to take it to the next level and do very specific, there's like a battery of testing that the professional would do to see whether or not, now, in some kids may be slow, but I mean, any of those type things kind of bring you to the next level. This is something you really need to be concerned about.
Is there a relationship, which has been rumored, between inoculating children and the onset of autism?
It's very, very controversial. I mean, autism, Larry asked me earlier about this being a medical health crisis.
Right.
The numbers right now are 1 in 150 children, 1 in 94 males. It's
unbelievable.
So it's more than 1%. And those numbers have, in the last 15 to 20 years, exploded, by a factor of, 100 almost. Mm-hmm. Wow. So there's something going on. Mm-hmm. There's clearly, it's multifactorial. There's some genetic components. I mean, sometimes it'll run in families. You'll see uncles and cousins that have it. And they just identified last week at Harvard 6 genes that they think are contributing to this.
And definitely environmental triggers.
Right, that'd be something.
So looking at mercury and other environmental triggers.
Right.
So they're going to find many different causes of autism. So it's very complex, and it's going to make it much more difficult to treat.
I mean, it's controversial. There was mercury thimerosal in the vaccinations, and it makes sense to take that out, no doubt.
Absolutely.
They've done studies. The government has come out and said no. I mean, they did a multi-blind gazillion studies. A lot of families disagree with that. In fact, this case in Atlanta. So I mean, it's incredibly controversial. They talk about spacing out vaccinations. That making sense. Taking mercury out is clearly that. But I think there's more than that going on also. I don't think it's exclusively just that. Because the numbers are still increasing and it's still going up.
Could you tell the viewers, seeing as you're pioneers in finding care and support groups and instigating many of those for autistic children here in Orange County, could you inform the viewers about some of the things that you do to encourage good behavior, or the support groups that you've started or that you seek out?
One of the support groups here locally that we highly recommend is talkanow.org. TACA. And Lisa Ackerman has done a phenomenal job of setting up a website that is a tremendous resource for parents with children who suspect their child have autism or are first diagnosed. Jenny McCarthy now is acting as our spokesperson. Autism Speaks is a great resource, especially when we talk about the first signs to look for. So anybody that suspects that their child has autism, I'd refer them to the Regional Center of Orange County, to OC Kids. So we do have resources here that are kind of first stops.
So in your opinion, do you think identifying this condition early changes the outlook for them? I mean, if you're a parent and you really say, my kid's 2 years old, this isn't right, I want something done now, I mean, is that really worth fighting for? I imagine. You think it changes what's going to happen?
Absolutely. It's critical to get them diagnosed and early intervention. Now, there are some programs that I believe they've said they've been able to identify kids at 6 months. We identified our children early, so a dilemma is finding highly qualified people to provide ABA intervention, which is empirically based. So there's a severe shortage of providers. We need to get more people qualified, and I feel like we need to be assigned a crisis team at the moment of intervention, because often children require 40 hours a week of applied behavior analysis, speech, OT, vision, costing $200,000 a year.
Is there evidence that as they get older, the condition, becomes more progressive, or does it level out, or does it?
I think each kid is variable, and a lot depends on whether or not they receive continued supports. A lot depends on the quality of the early intervention they're getting, whether it continues, what age they started with it. I mean, nothing's 100%, but kids who start at 1.5, 2.5 do better than kids who start at 4, 5, and 6 generally.
But we really want to convey that there is hope, and kids could benefit at any age. So we found the brain is very malleable. They can certainly benefit at any age, but the earlier the better and the more intense.
Say you're a mom, you have this gut feeling, and and the kid is 2 or 3. Do you take them to the pediatrician first, or do you say, I think they have autism, I want to take them to a specialist? And if it's a specialist, what type of doctor would you take them to? Most
parents usually go to a pediatrician or a neuropsychologist. I suggest here in Orange County for OC Kids, and also checking the TACA website. And there's also some great parent support groups on Yahoo now. So parents, I think, are a tremendous resource. Because you are a pediatrician or a psychologist doesn't mean you have any special knowledge in the field of autism. So I think you want to find someone who has specialized expertise in that area. Because you may look at my child one day, they may appear that they need to be institutionalized, and they may be acting like I'm going to be institutionalized if they aren't. Or my child might act like a genius. So if you happen to be evaluating them during that time, it's going to be very difficult. They have a wide range of behaviors in different environments.
So you need to be careful not to take just a snapshot of that one day or that one incident. Right. You need to they need to be observed over
time.
Right.
Over time.
One of the hallmarks of the disease is variability. I mean, you and I may have a window, good day, bad day, here, and we're in this way where they may be, triple, quad, that kind of stuff in there. Exactly. So their swings can be You know, and there are times when you look, you look at, you know, our children or other kids, but they're perfectly normal, everything's fine, and other times not. So I think that's a very good point. I mean, a one snapshot in time
Doesn't make
may
it.
not necessarily take
And
us
the
far.
degree and frequency of our children's behaviors is really what sets them apart from a typical peer. You might say, well, my child does all of these things too. This is the terrible twos, or
Yeah.
Right.
but identifying that the degree and frequency is much different. And First Signs on Autism Speaks website actually has video clips because it's very subjective when we talk about it, and they put it in more objective terms for you.
Right, and the parents can look at what a normal 15-month-old would do, and then an autistic, and you can say, my kid's
One or the other.
much
Yes,
more like, you know.
Exactly.
Yeah.
Right. Well, we're about out of time right now. You are very brave, wonderful people, and superb pioneers for this cause and helping lots of people.
Pioneers is a generous term. There's lots and lots of people doing that. I mean, we're trying to do what we can, and we certainly want to help our kids. But I think it's important that, you know, that people realize at you know, how severe crisis this is and what's going to happen. I mean, we have 50,000 children in California and growing who have the diagnosis. What's going to happen to these kids when they're 18 or 21?
Well, thanks for coming on. I think even if one extra person hears this and gets their kids to treatment early, it's worth that you've been here. I mean, you really gave your heart and soul to
Yes,
this,
you
and
did.
you should be commended.
You know,
Absolutely.
again, thanks for having us.
Yeah,
and letting us-
thanks
Thank
so much
you
for
for
coming.
giving us the opportunity to educate the public.